Yeah, I guess I have a comment and a question. I'd like to echo your thought about New York being so large that you have to perhaps address it a little differently. And going after it in sectors makes a lot of sense, but even when you do that, if you look at the healthcare sector, compared to Madison. Madison had 3 hospitals, got together with, I think, 30 businesses, did some very good things. You've got almost 100 hospitals for long-term care, and it's well over 200. I don't know how far down you have to segment this to make things manageable.
I think it works the other way around. If you and the healthcare people are getting together, very quickly you discover that there are things peripheral to you that are essential. You can't reach them. And through the coordinating council, it can help you either to reach, organize another group, or to integrate a group with you. The whole idea is that these different communities of interest still do occupy both the geographical and I don't know what to call some kind of economic sphere, some sphere that is beyond your purview but important to you. And through this council, you can reach to them. Now, that brings the whole issue of guidance of this. That the steering committee or the council that we create, which will have representatives of all those things, needs to think in terms of having policy guidance for others. For example, let's say that I have the good fortune to live in New York now, and I have, I'm on this committee. Then we go to you and say, now, the first thing we want you to do is to state the aim and objectives of your group. And this is what we're trying to do, and we think we're going to be consistent. When we have that, you are free to do whatever you want to do, but you should be discussing with us so we can help you to coordinate with others and so forth. But you are an autonomous group, and do that with every group. Then what happens is some rise, some fall, you get success, and so forth, and you build on that until finally it shakes down, and you have all of these active groups. Being free, not being driven or not being told what to do, right, but encourage. And then, if I may make a suggestion to you, Steve, you do not go to people and say, tell me your needs so I can serve you. You go to them and you say, tell me what you're trying to do so we can figure out how to work together and do it better. That's a good way to put it.
Yeah.
Because people want to be important, significant. They don't want to be welfare recipients. Right? Now, if you deal with them in that way, and then you say, if we're to work together, we've got to understand our aims. Tell us about yours, you ours, and then how will you do it? Because you don't want to listen in the relationship. We got it. You just tell us what you want. We're going to do it. You can't fulfill that. And it's not the way it works. Now, specifically, what we would propose to you as to consider would be get together with your people, consider this problem, define it, and what can you learn from other people, and what would you propose to try? Then we do what we can to help publicize it, get you support, so forth and so forth, to try it out. New York is unique. It's not going to go find a template someplace else. Now, that's the way I would be responding to you with that question. Make sense? Yep. Diana?
Well, how do we ensure that there's a standard among our membership, our core group, and our council in terms of speak the same language and understand all the nuances under this rubric of quality? And in inviting people to participate, at least at the ground level, can we say no to people who don't feel yes,
you can do that, and you must. It's very difficult. But I'm talking about the very small organizing group. As you grow, for example, the healthcare group. Well, we urge that the 3 or 4 people that are starting really know this. Then they will have a lot of people who don't quite know, and they'll do that. I'm talking about that top group. And as for quality being amorphous, well, there are quite a few of us. I travel around the world and I meet quality leaders, here, there, and elsewhere. And we, like that, we know. We may have learned from different people, Turan or Weidenbaum, but there is a common core. Right? It's well known. But we are constantly struggling with the fact that this is, for most people, a new area, and they come aboard, and they're changing paradigms. Yes?
By the way, Diane, I'd like to add to that to some extent, and I fully agree. Quality is not a method. Quality is an outcome. The method is managing in such a way that you achieve quality. When you gave your story about looking at past methods of management, and you talked about control, they unfortunately, we use the word quality control, and that word has a totally different meaning in fact, but Schumann founded it than it does today. So what is really important is knowing the management techniques to achieve quality. We keep talking about quality and confuse the issue totally because of it.
Yes, you're quite right. There is no way to avoid the general confusion that goes with changing paradigms. It's messy. But those who are practicing it, there's really just like that, common knowledge. I meet this guy in a few minutes. I don't know where he learned. He doesn't know much about where I learned, but we click right away a whole series of things. And there are now some books that are doing this quite well. But there's also a lot of stuff out there that's pretty bad.
So again, as we pass the 10:30 mark, those of you who thought that this was going till 10:30, is there anything you'd like to say to address the issue of how we can work together, thank you for the language improvements support to make this happen together? We don't claim to have the answers, but we know that when people work together, there's a synergetic effect. And they fill in the gaps, and more happens than whatever happens working separately.
I have a question of you, and that is, what is the aim of this movement?
This is a campaign, the purpose of which is to see a quality council be established in New York that is capable of thriving, not just surviving.
Short-term aim.
Short-term aim?
And what's long-term aim?
Long-term aim is to have New York City be a city that works for everyone.
I have a question, Myron. What's the closest model of a community that is moving against the system? Rather than what's going on here, you're talking about how we're different. There is none. I don't know of another one. I agree with Martin.
What about Philadelphia?
No, Philadelphia is beginning to move. Philadelphia has been centered on the Chamber of Commerce and the things, just Chamber of Commerce. And we had a very interesting meeting because I can't remember the name of the lady from Philadelphia who came to our community quality coalition board meeting. And we listed what we're trying to do, and she said, "But we're not doing that." And I said, "You're doing great things, but well, we're going to." And so they're starting to reach out, and maybe a discussion with the PACE folks that are onto this path would be useful to you. But as for people that are already doing it, the answer is we don't know any. But I think see, basic problem. People that run conferences and seminars, and their budget is positive, and they're doing a lot of things, and say, "Hey, we're doing great stuff, don't criticize us." But I haven't seen where you're looking at welfare. I haven't seen what you're doing about education. Oh, we're working with this university. No, I mean the whole city. Right now, we've tried, and not been too successful, writing to all of the councils we know about, and said, "We would like you to appoint a local committee on education and get involved with your schools. And then we'll tell you what other people are doing, we'll exchange views, and you'll learn how to do it." It's just beginning. Learn how to do it in your case.
Coming very much. Thank you. 10-minute break.
The only form in which